over there.
Get on up.
Everybody right there.
Get into it.
Everybody right there.
Get involved.
Everybody just come on up. Come on up.
All right, we have Rumph Perry, Director of Programs at Journey's End Refugee Services, and Natalie Crespo, Medical Program Assistant at Journey's End Refugee Services. And today we're talking a little bit about language access and how this is affecting the medical and healthcare provision to immigrants and refugees here in the Buffalo area. So Megan and Natalie, could you start by just kind of giving an overview of how language access and cultural differences are affecting the medical and healthcare provided to immigrants and refugees?
Sure. So when we accept a case for resettlement through our office, we are required to have language services for that case within our office. So if we resettle Burmese Karen speaker, we have to have access to a Karen interpreter for all of our services. But then we connect that refugee with service providers in the local area. And those service providers are in turn required to provide interpretation, and we don't have the budget to cover interpretation for all of those service providers. It would just be unrealistic for us. But we do provide support and training, and we have a fee-for-service interpreting program. So we are always looking for providers who are willing to work with interpreters and work with us to get the training that they need in order to provide culturally and linguistically competent services. Natalie can tell you a little bit more of the specifics.
So part of what I do is I make sure that all clients that arrive here have a health assessment, and they're also connected to primary and specialty care.
Could you talk a little bit about any specific situations that you've seen your clients go through where it really raised concern about the medical care that they received or were unable to receive?
Well, I've seen a few cases where when they've been scheduled to go see a medical provider, language support may not be available, or it is available and there's some hesitation to use it because they may not want to pay. Some time ago, we had a client go to the emergency room and they couldn't get her specific language on the phone that day from language support, so they ended up discharging her. I've also seen cases where any medical provider that accepts Medicaid, they must by law also provide language support. I've seen providers that do accept Medicaid not provide the support. Or I've went places and know that they do it and they tell me that they don't, so sometimes it's a struggle depending on where you go.
We also have cases where an inappropriate interpreter has been used. So a woman who goes in for a medical appointment and her teenage son or her husband is used to interpret, it doesn't give her the space to speak confidentially and comfortably with her medical care provider about her needs. Because even though there is interpretation for her, it's not a professional interpreter, and that's obviously can be confidential if it's her family member. So we see those cases.
And what is your follow-up at Journey's End in those situations? How do you address that?
It's hard because we have to, those are our partners, and we don't have 10 primary care healthcare facilities for newly arrived refugees, so it's not sort of like if you don't like the mechanic you work with, you just go to a different shop. These are our providers, these are the people who want to work with us and are willing to work with us, so we do our best to partner with them to talk about how the situation could have gone better and to provide training and to ask that they provide a professional interpreter, but we're not always successful. It's very expensive for healthcare facilities, so it's limited. We will file a formal complaint, and in some cases we have with the hospital, for example, but beyond that it's really about advocacy and training.
And what are some of those success stories that the advocacy and training has, you've seen changes in the system that have really helped?
Well, recently I went to a hospital, and most times what they do is they just use the phone for language support. So in some cases, one room might just have the phone and another room might not, so we might have to wait till the room opens up. But the hospital that I went to, they actually had their language support kind of set up on a laptop, so everything was wireless and you can roll it between the rooms and you can log right on, and go to which language you wanted. In some cases, you could even Skype with your interpreter, so it's a little bit more comfortable for the patient.
Mm-hmm.
So to see that made me really excited.
That's great.
So,
Yeah.
And we're also seeing creative things and new things happening, and like community health workers that are going into homes and helping people understand what's going on and being able to spend more time. And the community health workers are often from their ethnic community, so they're able to understand the culture and speak directly to the patient in their language. We see some programs focusing on prevention, like helping people who are diabetic understand how to live with their medical condition and the diet changes they need to make and how to use insulin and all of those things. So we're seeing some new ideas for how to combat sort of this communication challenge instead of just limiting it to one way of treating folks. And I think that's helpful and on both sides.
Yeah, it's great to hear that there are some really positive things going on to address these issues.
There's a lot of good things going on with refugees in Buffalo. We have some cases where it's really rough, and we're always working to improve. But Buffalo is a very good place for a refugee to be. It's a really good city for refugees.
Well, thank you very much for sharing a little bit about what you're doing at Journey's End Refugee Services. Again, this is Megan Rumph Perry, Director of Programs at Journey's End, and Natalie Crespo, Medical Program Assistant. Thank you.
Thank you.